Cardon Children's Medical Center, providing comprehensive pediatric care for Arizona's families.
We're here today for a pre-surgery class for my daughter Elise, who's having surgery to correct her kidney reflux in the morning, tomorrow morning.
We offer here at Cardon Children's what's called a pre-op class. It's optional free class for anyone in the community that is having surgery here at Cardon Children's. We meet the class, the patients and families, down in the lobby, and we show them the admitting area, where they're going to get checked in on their day of surgery, and then we take the elevators up to the 6th floor, which is where we do the class, and that's where we show them a little video. It's a great class for the whole family to come, parents, grandparents, brothers, sisters, and they come and they get to hands-on play with the medical equipment. As you see here, they can touch the stethoscope, put flavors in their mask, play with the surgery bear. We talk about how they're going to wake up with an IV. It helps them to hands-on experience what surgery is going to be a little bit like. It does seem like it's a lot of extra for someone to go above and beyond and come to the hospital prior to their surgery day, but we find that it's really beneficial for a child because they're able to actually see what's going to happen. A lot of children, especially in that preschool age, they have a lot of magical thinking and misconceptions, and they're going to think that surgery is a lot scarier than what it actually is. So if they can be prepared beforehand in their developmentally appropriate language and be able to have control of the situation so they can be able to hands-on feel the things that are going to be used on them, it's going to help them cope better with being here on their surgery day. And then we take a tour of surgery areas so that a child can see beforehand the different rooms they're going to be going to.
That's the lobby where you come in. And you can see the trees. Yeah, it's the top of the lobby. Mm-hmm.
It helps the children feel comfortable, and it helps the parents feel comfortable too. I mean, you can talk up the surgery to your kids and tell them that everything's going to be fine, but as a parent, you're nervous, still. Like, I woke up in tears this morning, and I'm not like that about this. I mean, I'm very comfortable in hospitals and comfortable with doctors, but it's something different when your child is wheeled away and they are put under anesthesia. It's a little scary.
If anybody wants to see, this is what the straw feels like. So a lot of times parents are really anxious about their child having surgery, and that can perceive onto the child. So then the child starts to become anxious because their parent is really anxious about the surgery. Or if the parent, is scared that they don't want to tell their child that they're having surgery, they think, oh, it's just going to make it worse. And they lie to the child and tell them that we're going somewhere else, because we have had parents who do not tell their child that they're having surgery and say, oh, we're just going to go to the park for a little bit and then we're going to come home. Well, that child starts to build distrust with their parent. And so we really believe in being honest in an appropriate way as possible with the child so the parent can have a trustful relationship with the medical staff and with their parent.
This in my arm, like this. They'll put a mask on me like this. And also, we can get like a little fan. I'll cover up all your hair. And this what you'll get this is what the doctors will wear. And they'll put this right here and put it on your tummy and your heart.
I think definitely what parents can do at home is making sure that they use appropriate language. We have to be really careful the terms we use with children, because as grown-ups, we get comfortable with saying, oh, you're gonna get put to sleep, or they're gonna put you on a stretcher. Well, when a child hears the word stretcher, they think, oh, they're gonna stretch me. When a child hears the word, I'm going to get put to sleep, they think, I'm going to die like my dog did. And so that's why we really need to be careful with these words. Your arm like this. Just like that. And they'll hook it up to
We're
this
just
right
really, out in the open with it, and just tell her the facts. But we've also made it so it'll be like a fun day. So she's got to pick out new pajamas. She has toys that she can't play with until we come to the hospital, and they're all in the bags. The child life specialists, I talk them up to everybody that I come in contact with because they're just fantastic, and they are all about the kids, and I love that.
If a child has been through surgery before, if they've been through preparation, they're able to cope better in the long run with doing things in the hospital. I love my job. It's great.